Health Education Lecture Series. All the listeners of Health Education Lecture Series, I'm your host, Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 9701 Sarah N. Court, Dublin, California, 94568, and phone number 408 687 1899. Anytime, if you are suffering from any disease and tired of treatments, please call me 408 687 1899 for discussion, or even if you want to take a second opinion of your disease, yes, even then you can call me at 408 687 1899, or you can send your message regarding your complaints on email, homeomedicine, HOMEOMEDICINE at yahoo.com. And you can take advantage of my 52 years of medical practice experience, out of which I was teaching in medical colleges for about 26 years. And since I'm in USA, 96, since then, I'm delivering my lectures on TVs, on radios, on different medias, newspapers about the health education lecture series, so that all the community members who can understand Punjabi, who can understand Hindi, who can understand English, they can know about their body, how this life was generated, how this life was running, developed, and the mother's web that after onward, out of mother's web, what were the conditions, time to time, what were the problems he has faced during his journey, from being started with the combination of sperm and ovum in the mother's womb, and after that, time to time, he faced many difficulties, many problems which will cause the diseases and abnormalities. And we have discussed each and every abnormality time to time and described about the development of this body after birth, even being separated from the mother. We have described criteria of this life, journey of this life from day one onward, depending upon different phases of the lives, just like the newborn, the toddler, and the adolescence life, the pre-adolescence life, and adult life. And after discussing all these chapters one by one, we are at that now, if a person falls sick, what are the general problems? At the first instance, what we should think about that one. And that has been described in my previous lectures, that there is a deficiency of the immunity. Immunity was given by the mother and father basically, and they were working with that one. And when after that they joined, their joint immunity was working for the survivals. And ultimately, when it was plugged into, anchors into the mother's womb, it was getting immunity from the mother's blood. And when he came out of mother's womb, it was taking immunity from the food environment where it was. And ultimately, some of the foods, some of the environments may not be suiting to this new life of new body, and they are creating some problems. And we were discussing all those problems one by one, that what may be the cause, whether it's environmental, whether it's a dietary problems, or in general, everything is okay, but inside the body, there are some type of problems that they cannot adjust this environment, they cannot adjust this food materials, and cannot generate the immunity. So that was the endocrine system we have described yesterday. and in all the languages, English, Hindi, Punjabi, we described all this thing, all the three main points. The third main point was to discuss that if ever this body is running normal, being fed normally in a good environment, but even then it falls sick. What are the reasons? The third one reason was that there may be a garbage residual inside the body. Nature has made a systematic program that the garbage from each and every cell, from each and every system and organ should be released from this body time to time, and there is a pattern for that one. Garbage from the food materials generally is released by the stool, anus, and also the urine when it goes to the blood and circulating through the blood, and the blood is collecting garbage from the different tissues, and ultimately it goes to the kidney, and kidney cleans them and send it out by the urinations. And after that still some of the garbage remains, and that also again continues circulating and goes to the skin. And also skin has a way of evacuation of that garbage that we know as sweating. And with the sweating, most of the residual garbage goes out of the body, and wherever the garbage is released, those organs particularly have their own complaint. Just like in the anus there may be hemorrhage, there may be warts, there may be prolapses. In the same way, the in the urethra there may be UTI, and there are many more problems that we will be discussing time to time in these lectures systematically. But we have discussed all these things, that the garbage is released from this body. That was the third point. The first point, internal immunity. Second point, internal heat producing system. Again, that's the endocrine systems. And after that, the third one was the removing of the garbage produced by all this functioning of the body, or all this functioning of the internal system of the body. So in this way, the third and stool, urine, and after that the skin, still some garbage remains, which comes from the different other organs and transported from the blood to the lungs, and the lungs they released it by carbon dioxide type of gases via the respirations. So it means breathing is also a way of releasing the garbage from this body. So all these sources are to release the garbage from the body, and in this way, if the garbage is not released normally, a body may become sick ultimately. So these are the basic norms I have told you about this body. And after that, some of the different signs and different organs, just overall, regarding what we see on the skin, what we see in the eyes, what we see in the different other organs, and what we assume from these signs, what type of disease a person may have, even from the discoloration, from the eruptions, from the erysipelatous, from different kind of skin expressions, different kind of oppressions of the eyes and lips, no nails. All these things indicate us that something is going on wrong inside our body. And now after that, we are now able to pinpoint that one, that what type of signs, and at what reason these signs are, and what they are indicating, what type of damage is inside the body, what type of organ is not functioning normally. So it gives indications about that one. So regarding most of the systems, the overall system, overall general, you can say the lectures we have given, if there be changes in the kidney, if there be changes in the heart, if there be changes in any other systems, if there is a constipation, if there is a any blockage in the intestinal areas, all these things, what they produce, what's going on inside, it is represented outside on the skin and on the various organs like eyes, nose, lips, nails, skin, everything. So this was our previous lectures, and we have delivered these lectures in English, Hindi, Punjabi. I think it is twice. After that, from now onward, we have started a systematic study of one by one the part of the body. Just like if we describe the body, we say head, and second part we say the trunk. Head, neck, they are included in each other, but head, after that the trunk, and the trunk, this whole body from chest to the abdomen up to the end. So then we divided this trunk into two parts. That was the uh, chest and the abdomen proper. And then the proper abdomen was also divided internally, not externally. Chest and abdomen, they are divided externally. We can see that. But the division of the proper abdomen into the pelvic area and into the proper abdomen is not visible outwardly, it's visible only internally. And this internal division is known by the you could say a covering, peritoneal covering, and the greater sac of peritoneum or lesser sac of peritoneum. They divide this two sections, pelvic area and the abdominal area. So all this has been described. But now onward, we will start that every division of this body, just like head, scalp. We have described the structure of the scalp, what are the bones taking part in that, and after that, we will describe what are the there are many more different organs. We are not just entering into the organs at this time. No, we are just describing you the external signs. If there be any disease, if there be any problem in the normal go of working of the internal organs in the head, just like cerebrum, cerebellum, mons, medulla oblongata, all these things are the pineal body and different glands, just like hypothalamus, pituitary glands, pineal glands. All these things are the internal, they are making the structure of the internal brain. So we do not know at this time. We are not entering into it. But externally, if anything becomes sick inside, if anything is damaged inside the skull, how you can find out without going to the doctor, without doing any lab test or all this? And because many times I had described you that it's a clinical diagnosis. Everybody was trained for the clinical diagnosis, so that just visualizing the outward patient, we can recognize that what type of disease he is having, so that we can refer him to a proper type of department which can deal with this one. So in this way, all these things are very important for everybody to learn about, so that in case if they face any type of any of their relatives, any of their friends face this type of conditions, they can realize that, and they can help him to provide immediate help, because they know it. They know it, what type of problem he is having inside the body, and they can refer him directly to that type of department of the medical science or the hospitals, so he can get immediate help and can survive from that one. So now onward, I'm starting systematically from head, then after that, from the neck, from the chest, from the abdomen, from the pelvic area. If there be any problems, if there be any type of organ, because there are various organs in the brain, various organs in the neck as well, and the various organs in the chest as well, but very important organs. And the same way, the important organs are inside the abdomen and pelvic areas. So I'm not describing what type of organs. No, I'm just giving you a general idea that if any organ inside the brain is not working, we will go to the personal. We go to the individual organ. Suppose if cerebrum is damaged, What will happen if a cerebellum is damaged? What will happen if any gland is damaged? What will happen? And all these different organs I will describe. But today's lecture will be just generalized, that anything happens inside the brain, anything happens inside the brain, damaged inside the brain, what type of signs you can see outwardly, so that you can recognize that these are related to the brain. Just like yesterday, I told about the signs of jaundice, and they are visualized in the eyes, they are visualized in the skin, they are visualized in the urine, and all that. So, in this way, what will be the indication outwardly if any organ as a whole brain is damaged by one or the other thing, then how you can recognize this thing, that there is some problem inside the brain. It will be a second step, that what organ inside the brain has damaged. And before that, we can go to the doctor, even they can detect it and they can find it out for the proper treatment. But individually, at the first instance, from the outwardly expression of the body, you can recognize that this person is suffering from something damage in the brain, something problems in the brain. So today's lecture will be outward signs of internal brain damage. So, in this way, we can say these are the general physical signs, general signs on the face, general signs in the eyes, general signs in the, you can say, the ear or nose as well, a mouth. So, all the different organs will express their concern, because brain is the one which controlling all the systems, all the functions of the different system via the nerves. And if that controlling power has some type of defects, automatically a particular type of organs will show up their problems, that this is what we are not getting normal influence, normal current, whatever. So this is what today we will describe it, that if we are considering that someone is having a brain problem, maybe sudden injury, maybe a long back suffering from the diseases, and now at this stage, when you go to see him, he is having brain problems. And then, so immediately when you see, if a person is having brain problems, you see the eye. First of all, what you see his eyes. You see his eyes, and his eyes will be wide open. Especially when I say why eyes, it's a little bit wrong explanations, because as a whole we say eyes. But when medically terminology we explain this thing, it means the head and the pupils are different things. Sorry, pupils and the lids are the different things. So lids are which covering the eyes. When there is a problem inside the brain, lids falls down. Means always the patient is with closed eyes, cannot open the eyes. And if you see his eyes, the pupils, that the black hole you see, inside the eye, you see the white thing that is known as conjunctiva. The I'm talking about the pupil, that is the black hole. That black type of hole, circulating power, that is the lens, and that is enlarged, that is not contracting normally, to squeeze and to find out what is going outwardly, to picture you. In other words, you can say, just like the camera mirror is capturing the visualizations of the outside and send it back to the brain. So those that, that that area, that lens area, is enlarged, it becomes wide open. And second thing, you will see that just like normally you might have seen in the hospitals, doctors open their eyelids. Eyelids are open because they are closed, and then they put the light in the eyes, and these black area normally in a normal person is it is contracted and relaxing, contracting and relaxing. This is a normal routine of the eye moving. But if there be any problems in the brain, maybe brain hemorrhage, maybe injury somewhere, whatever, maybe there is excess of fluid inside the CSF or all that. So there are many more, many more things which happens inside the brain. We will discuss one by one later on. But here I am just describing general signs. So general signs are that if there be any brain damage inside, then the lids are closed, but inside the lids, pupils of the eye are more dilated, plus they are not sensitive to light. And when you put the torch on that one, they are not moving. And this is also a important sign that he is having, though we know that this is the optic nerve. There is the optic nerve which supplies the sensation and functioning, a feeling, locomotory and sensory. All the functions are supplied to the eye by the optic nerves, and capture the outwardly expressions and send it to the main area, which it decides what it is, what we are seeing. But but as a whole, in general, when brain is having any problems, all the internal organs, more or less, are affected, and they produce deficiency in their normal functionings. And if they produce deficiency in the normal functions, we are expecting, we are seeing general signs on the in the eyes, and that says pupils are dilated and they are more larger. Just like if you see that a person is addicted to opium, his eyes are contracted, small, that black hole becomes small. But if a person is having this kind of problems in the brain, which is not physiological, which is pathological, abnormal things, then that pupil is dilated and not responding to the light. It is more sensitive, and sometimes it may be that if something is directly affecting the optic nerve, there may be loss of vision, or partially, if it is affected, there may be a double vision, there may be a partial one-sided vision. So something could be, depending upon the damages in the or the pressure on the optic nerve inside the brain, but indicating that something is wrong in the brain. On the other side, there may be a fluid leakage somewhere, because CSF, cerebrospinal fluid, a fluid which is circulating throughout the brain organs. And through this fluid, that is just like the streets I have explained you, this brain as a whole is a big village. Just like village, there are many more houses, and every house has its own boundaries and own outward boundaries. And out of every house there is a street, so that people living in that house can go out from the city, from the village, and come into their houses. So these are called the streets, and in this way those streets are the ventricles. And in this ventricles there is a flow of water that is known as CSF, cerebrospinal fluid, and that fluid is always circulating in the brain and the vertebral column backside. Okay, it's moving always, and collecting the information, collecting the garbage, and supplying the food supply from the blood vessels entering into the brain. So this is his function. But if I'm talking now, if that fluid has leaked somewhere, because streets are streets. And if streets are damages, any garbage, any other things from any house may leak and go into that street. Maybe blood, maybe something else, or fluid from these streets can enter to in any house, in any part of the body, brain. So in this way, that can cause a problem. And even it's not only the fluid only, there may be a blood. If there is an injury, that may be a blood. And that blood can put pressure anywhere in a particular type of nerve, because there are 12 pairs of cranial nerves inside the brain, which are passing from the brain through the foramen magnum into the vertebral column, neural canal, that's known as the neural canal in the vertebral column. And they pass from the vertebral column time to time, space to space, and ultimately control the whole body, all the organs in the chest, all the organs in the abdomen and pelvic, and everywhere in the extremities. Everywhere they control. These nerves are going out from the vertebral column and coming inside the vertebral column, supply the sensations from the central organization, and take the orders from the local area and supply it to the brains. In this way, this coordination is going on. But you just remember that fluid has its own consistency. But if blood has been drained by injury, by something else, even where some people are having high blood pressure and something happens, we call it stroke. There is a stroke, and means some blood vessels has been ruptured by the pressures, and that fluid has come up. Where it will go? It will go into the ventricles. It will put pressure into any nerve. It will put pressure to a particular type of areas. And wherever it will be, it will damage the, harm the function of that organs. Just like I just talked to about the eyes. If the optic nerve has been getting that pressure of the blood or of anything, or even tumor, or if there is not bleeding, there may be a tumor. So in this way, that damage, there are different conditions that I will tell you later on. And it's not that a tumor immediately bleeding causes effects immediately, putting pressure immediately. But if tumor grows, it grows gradually, and it reaches to an extent when it fully pressurize that nerve, and that particular type of nerve, any nerve out of 12 pairs, any nerve could be damaged. And those signs and symptoms comes up, that we will discuss later on. But here a general idea that brain somewhere, we do not know, because that's the criteria of the doctors and the hospitals, that they should know it. Being doctor, I can just tell you that your mark your landmark is only up to just recognizing that what area of the body is affected. And how you can know that? You will know it from the external signs, what is going on. Or sometimes the history shows that. History shows that, oh, he fell down head wise, and his head is, and his bone is broken. Bone has broken and cracked somewhere organs. If bone is not broken, even then with the succussions, internal organ damage, or the system or the program, ventricles and all the nerves and everything has been disturbed. And if ever this happens inside the brain, then all these signs are the foremost and first appear, that every person should see and recognize that this is something related to the brain damage. Again, I will repeat it. In general, pupils' eyes are closed because he is unable to open the eyes. That's also a criteria of the particular type of nerves which control the lids. Lids of the eyes are controlled, moving, flickering. It's different things. But Lids are closing. You have to open the eyes, but you will see in the eyes that the pupils are dilated. That black hole, black area inside the eyes, not the white thing. Black area that is dilated. And plus, when you put some light in that one, they do not respond. In any general person, if you put light in the eyes, immediately they flickers. But when person is having this kind of problem, they are insensitive. They are not sensitive. They are not sensitive from the lights. So this is the main important indication that something has happened inside the brain. Or with that one, even pupils are large, even they are not responding to the lights, there may be loss of vision. And there are reasons of the loss of visions. Reasons of loss of vision: partial vision, and lower area vision, upper area vision, sidewise vision, half vision. In this way, there are many more conditions, and that we will describe later on. Why a person sees only the lower half of the person, why a person can see only the upper half of a object, and all that. Well, right side or left side, all this I will describe later on, so that you can understand that if the right side vision is lost, what's there? If left side vision is lost, what's there? If the upper part, a person can see only the upper part of the object, what's there? So in this way, everything I will describe you later on, but I'm giving you the general idea that if the brain has any problem, injury, or any internal damage, or any internal problem, growth, tumor, leakage, whatever, so these signs will be, you can see in general on his face. And after that, just like the anemic patients are generally the pallor of the face, that is known as pallor of the face. But in this area, you can see the redness of the face, and there is a difference in that one. After that after that there may be blood drainage. Sometimes you might have seen in a routine, a person is suffering from high blood pressure, and sometimes he has a redness of the eyes. First of all, simply red veins he can see in the eyes, but ultimately the whole white area, that is known as conjunctiva, that whole white area is red, because something small blood vessels has been ruptured because of the excess pressure inside the eyes. And even nowadays, doctors have instruments to check up the pressure, internal pressure of the eye, so that this is the normal pressure and this should be the normal. And this person was having high pressure inside the eyes, and they have the means to reduce that pressure by medications. But even if they have not gone to the doctor before that one, and that small vessels in the eye has been ruptured, their blood may come into the conjunctiva, the white areas. Okay. After that after that if something like that happens, maybe blood, maybe fluid leakage, maybe whatever it is, what you will see, they are dark bruisings around the eyes. Bruising means scratchings. Scratching, you can say, and just like we are fighting with each other, and he put his nails on his face and scratch the face. In this way, these type of signs are generally visible around the eyes. Scratching signs around the eyes, if there be any leakage of fluid or blood inside the brain, along with other signs I just told you about the eyes, there will be scratchy eyes, battle signs. We just see the just like in the battlefield, we are fighting and scratching each other's face. These things appear, but these are not scratching from the fights. It appears when there is a damage inside the brains, and these are of dark color. Just like if there is a blood leakage in any way inside the body, but skin is not cracked. When the Skin is not cracked, the blood is leaked inside. Ultimately, you will see the brownish, blackish spots on that area. Scar, we say it. This is known as scar formations. And in this way, blood is leaking in the brain. But this cause head and mouth face, they are considered one. And that is why these signs mostly are indicative on the face around the eyes, that the dark bruishing type of signs means dark scratching type of signs that blood was inside there, leakage, and the oxygen from that blood has been sucked by the cells, and there is a black portion, the residual portion of the blood is there. So that causes that kind of signs over the skin, and particularly around the eyes. Other thing, we had discussed the immediate signs of the eyes. We had discussed if there is a fluid or anything else. If we are discussing about these signs of scratching type of things, if bleeding is inside there somewhere. Fourth sign, seizures. Suddenly, if anything falls on the head, your legs will not working. You will fall down. You will trembling, fell down. This is a normal thing that he is having a hit on the head anywhere, and the control of the nervous system was lost. That is why this legs were not working. I will tell you what this systematic inside the brain. Nature has set up a opposite type of functioning in of the nerves. For example, if a person is hit on the vertex, on the top of the head, his legs and feet may not work. Second, if a person is hit on the right side, and whatever the nerves are damaged, they will damage the left side of body functions. And if it is hit on the left side, right side body functions of the body will be damaged. This is you can say the internal structural setup by the nature of them. And I'm talking about in general seizures, just like epileptic seizures, just like there are many more various type of because epilepsy is the thing that everybody knows that. You know that how when there is attack of epilepsy, how they trembles, how they have froth, how the eye pupils are dilated, and ultimately they become unconscious side. This is known as seizures. Sudden uncontrolled muscle jerk are known as seizures. Sudden uncontrolled jerking, this is known as seizures. So this seizure is also an important sign of any damage inside the brain, if they are there. After that, along with this one, if there is any damage inside the, brain is compact thing. There's no vacancy, there's no vacant place in that one. And if it's a compact thing, if anything is coming out of the blood vessels, out of the ventricles, out of the organs, ultimately it will put pressure to the neighborhoods. It will put pressure to the neighborhoods. And when the neighborhood pressure will be exerted, mostly it is at the downfall. If liquid is coming and it is putting pressure downwardly, and ultimately the glossopharyngeal nerve, or the nerves which are controlling, that is the 10th cranial nerve, which controls the heart, which controls the lower portion of the stomach and all that intestinal portion as well, it excites vomiting. Ultimately, brain damage has important sign that a person is vomiting. It is not necessary that all the signs should come up immediately and all the signs should come up all together. It's not necessary. maybe one or two signs, maybe three signs, maybe even one signs, and it depends upon the severity of that sign. When there is no reason behind the vomiting, and you see a person is in uncontrolled vomiting, there's nothing comes up. There's nothing comes up, and the face also shows the redness. There is a vomiting, and there's also with the vomiting jerking of the arms, jerking of the bodies, all that one, and ultimately it indicates that brain has some problem. Brain, whatever may be the organs, but brain has some problem. When we will enter into the brain, we will find it out what type of damage can cause what type of symptoms, what type of damage, where in the area is damaged, and what type of symptoms will come up outwardly. So we are just discussing the outward symptoms of a brain, that I can just repeat it again. First of all, we discuss when there is any change in the brain. Eyes indicates that pupils are not contracting. Eyes are closed, lids are closed, person is unable to open the eyes, and it is not responding to the lights, and there is a damages to the vision as well. So these are the important signs, and you can recognize on every person's. And after that, bruishings, scratching type of signs, black signs around the eyes. We have seen that. Then after that, we have seen the seizures. If a person is having seizures after injury, or after any tumor which was growing, but not to that extent, that may be enlarging gradually, and this seizure type of things will increase gradually, because that is controlling, that's putting pressure on the controlling nerves. Locomotory functions are lost. In this way, all the things, when there is a excess pressure of outwardly drained blood or on the fluid, it causes vomiting, and person has a vomiting. Now, second step we can discuss, motor and coordination changes. All these are the main things we have described, but now motor means we are working with the legs, we are working with the hands, or our eyes are moving with the muscles. My mouth is, I'm talking, my mouth is moving with the nerves. So this moving or functioning of any organ inside the body is known as locomotion. Locomotory and sensory, these are two types of functions. Every organ inside the body, if is performing, they perform these two, locomotion and sensory. Sensory means to receive, to perceive the orders. What order is coming up, and you perceive that. What I told you, you understand that well. Then after seeing and understanding what I am saying to you, and you start working. Working is known as locomotion, sensation, and understanding the command, that is the sensory. So these two type of functions are controlled by the brain, and we are talking about the injury of the brain. It means either of the two or combination. Both locomotory and sensory functions are damaged. Locomotory functions are damaged. Then what type of sign you will see on the face, or on the body? So first thing is the general weakness. Person will fell down on the ground. Person is unable to wake up from the charpai or whatever he is lying on or sitting on. He is unable. Then loss of balance. He cannot stand himself. If he stands and you shall let him alone, he fell down. Or if you try to walk, him is walking is unsteady. If I want to walk, I can walk steadily. I want to turn right, I want to turn left, I can do that. But if a person is having any brain type of problems, He cannot walk steadily, he cannot walk straight, or this is indicating the locomotory function if there be any damage inside the brain. Loss of balance, he cannot control his body. Okay, just like narcotics, eh? Drug addicts, they cannot control their superpower. That drug is controlling him, and they work under that one, and if it is more, then they cannot control their body, they fell down. Or walk, just like they walk in this way, if they are having any brain damages, it is like this one. Speech, speech is also locomotion. Brain want to express something, and the tongue, our vocal cord inside the larynx, there is a box which controls the voice, which is responsible for voice, and the tongue or the mouth helps him to convey this one outwardly. But he is unable. He is unable to speak, or if he speaks, that is known as slurred speech. Slurred speech means babbling speech, or he's not having a clear speech and you are unable to understand what he's saying. So these are known as locomotory signs, locomotions, that functioning type of things. In the functioning, he is unable to stand. Functioning, he is unable to wake up. Functioning, he is unable to balance his body. Functioning, he is unable to walk. Functioning, he is unable to speak. So all these things are concerned with the working. So if any person is having any brain problem, he is having this kind of things. You can recognize from him. Yeah, what's going on with you? You are falling now. Okay, though it is in the beginning stage, there is a leakage inside the brain, there is a leakage inside the blood or something like that, or is a minor injury on the head, but that has not gone to the extent that there is excess bleeding, excess deposition inside the brain. At that time he starts, he wake up from the chair, but he cannot, he fell down. But he wake up, he stands, he cannot walk straight, he is babbling, moving. In this way, these are the important signs of that he has something wrong inside the brain. So, this is called motor type of coordination, and these are the changes when there is something wrong in the brain. So, two things we have discussed: general signs. General signs when there is anything, maybe blood, maybe fluid leakage, maybe injury to the brains, whatever it is, when there is any change inside the brain, you will see this kind of changes outwardly. So you can recognize that that person is suffering from any brain damages. And that I have described you about the eyes. Eyes are the main important thing that you have to see that. And the first thing you can recognize that this person is having this kind of problems. People are insensitivity to light, they cannot open the light, vision dimness or vision partials, all these things. So in this way, bruishes, signs on the face, especially around the eyes, seizures, vomitings, all these things are the important signs in general, but particularly I have told you the signs of motor system, signs of functioning, working according to the command. Brain commands, or you command him, yeah, do this thing. Yeah, wake up from the seat. But he is unable to wake up, rise up from the seats. Or he is lying on the bed, just like sleeping, but he's not sleeping. And you want him to wake up. He is unable to wake up, means he is unable to open the eyes. And even if he is able to, he will not be able to walk steadily, walk straight. Okay, he will fall down. And along with this one, dizziness and loss of balance is there, and seizures he may be having seizures. When you excite him to do something, but he is unable to control that one, it creates a type of irritations, and that causes imbalance in the nervous system, and he has seizures. That is why mostly when a person is having epilepsy, when a person is having a seizure of any kind, there are many more type of concussions of the brains and seizures, many types of seizures, and mostly they put the patient into a dark area so that even the light should not disturb him. And even if he is disturbed with the light, noise, any type of noise, light, it will excite the seizures. So that's why this is also in the brain system, that if a person has seizures, if a person is having vomiting, if a person is having bruises around the eyes, if a person is unable to control his eyelids, if his person's pupils are dilated, if persons are conjunctivas are red, all these are indicative of something wrong inside the brain. And the locomotor signs, I told you, he cannot walk, he cannot stand, and he cannot walk steady, and he cannot speak. Even then, you cannot understand what type, what he want to convey, what he want to said, or even if he listen, still ears can listen, but there are some other signs. They those comes as a sensory problem, because now the time is very short. I don't think I should put this big pressure on your mind, because you are not a medical line concerned to the medical line, so that you can remember all these things at one time. Just I'm explaining to you. It's better you should remember all these things for today, and tomorrow onward, though this lecture will be in Punjabi, in second language, but you should listen that lecture as well if you can understand Punjabi or Hindi, so that all the things I will repeat, but the words will be different, language will be different, and there will be more examples added to every day to my subjects. So in this way, so that you can remember all these things easily, I'm changing it every day. But the content, whatever the actually content is, what are the actually signs of internal damages is, that remains the same. That remains the same. So remember, after general signs, I have described the incoordination means locomotory signs, and after that, unconscious signs and the sensory problems, locomotory and sensory. So sensory problems we will be discussing next day, that what type of sensory problems you can, is very strange things. You will listen the sensory problems, what type of sensory problems a person is feeling when he's having any head problems. So we will discuss all those things tomorrow. Today's time is over. I am your host Gurdeep Singh Sandhu, homeopathic consultant, and my clinic address is 9701 Sarah and Court, Dublin, California 94568. Phone number 408 687 1899. Anytime when you are suffering from any disease at any age and tired of any treatment, please call me for your second opinion of the disease as well of your treatments, because there are scientific norms set up by the nature. Even when there was no medical science, even then the persons were getting sick and they were cured. And how the nature was curing them, we the medical science has learned all that. And when we are doing according to our own, just like Gurbani says, Sahas Syanpa Lak Hohe, Ta Ek Na Chale Nar. When we do according to our own senses, that I need this thing, I want to do it in this way, and we do not follow the nature's way, then ultimately we suffer. Ultimately, we suffer. This is what I can, if you have any problems at any age for any disease and your treatment is not progressing, I can tell you what's the proper way of curing this thing. It may take a little longer times, because we have to root it out. We have to cure the actually reasons behind any disease. And it is only possible and the only perfect way if we follow the nature's way. Before this medical science came in existence, peoples were getting sick, peoples were being cured. That's why we are here. That's why we are existing. Otherwise, every person would have gone. But we are going, we are surviving. Our forefathers were surviving. They were suffering, but even then they were surviving, and we are here. In this way, it indicates that there was a process, natural way of curing the sickness, and we learned that one. And I will guide you properly that if your treatment is going on these lines, yes, ultimately you will be cured. But if your treatment is not going or not showing this kind of signs, for every disease there are signs, not these signs, type of signs, you will not be cured. You may continue year together, continue to the treatment, but you will not, because you are not following the main route of cure. Just like many times I have explained in these lectures, you are coming from your home to my clinic, and when you go back to your home, you are crossing the same exits and the same villages or cities what you are coming to my clinic, and they are coming in reverse order now. Now, when you go back, you are getting the in reverse order the same exits, same cities, same village. You can understand that the road is normal, road is correct, and ultimately I will reach to the home. The same way we were healthy. From health, we have gone to the sickness, and when we go back to health from the sickness, we have to follow the same route, and same route will help us to go to the destination, that's the health. So in this way I can guide you. For each and every disease there is a different route, the way of nature I can tell you, because it is according to the functioning of the system, how a particular type of system is working, where is the origin, where is the end of the systems. In this way I can guide you for each and every system's disease, that this disease will be cured, and you will see this kind of signs ultimately, and you can presume that I am getting to be cured, I am getting to home, that is the health. So this is what I can guide you. If ever you have any problems anywhere in the world, you can call me, you can email me, I will answer you. And now this word has become a global village. Global village. There is no problem. There is no distance. Everything you can get in any country, in anywhere. Suggestions, medicines, everything you can get at one source. For that one, you can call me at 408 687 1899. And if ever you feel that these lectures are beneficial to you, beneficial to the publics, and then convey this message to all your nearest and dearest, so that they can understand what's going on in his body, in her body, and what is the causes behind that one. And if we want to get rid of these problems, how we can get rid of this one, they can understand easily before going to the doctor. And most of the things you can cure at home. In the initial state it's very easy to cure anything, but when it becomes big thing, complicated, it's very difficult. It's very difficult to be cured. So I recommend all of you, whenever you see any first sign of the disease, you feel I'm not okay, immediately you want to discuss with me, call me 408 687 1899. And all of your relatives, all of your friends, if ever they have anything, they can call it 408 687 1899. God bless you all. We'll see you tomorrow in Punjabi lecture. Thank you.